Good morning, good morning, good morning.
Good morning, Joy. It is always a pleasure to see your smiling face.
Part two of our discussion on racism as a public health crisis.
I think people have always known that there was there was some disconnect, right? And as far as why one group of people are able to accomplish and achieve and experience and another group has not been. And I think by giving it that title and putting the verbiage to it, it makes it real.
Welcome to the road to SoulJoy Wellness, where a coach and a therapist explore the journey to living your best life on purpose. Here are Joy Williams and Nadine Huesner, your hosts.
Good morning, good morning, good morning.
Good morning, Joy. It is always a pleasure to see your smiling face. How are you?
I'm good. I'm good. I'm good. It's great to see you too. And
hmm
one day we will see each other in person.
yeah,
It's
one
been a
day.
minute.
It's
It's
been
been a
a
minute.
really long minute, a very, very long minute, but we'll get there. I mean,
Mhm.
I'm so excited about, I'm really not, I am. Okay, so let me get my thoughts together. So this ability to do these video calls, it actually allows or makes me feel like I'm more connected to people because I actually get to see them and I'm in real time. So um, although it's been a minute, I feel like I see you often.
Yes. Yeah. It's funny because I know some people have Zoom overload, but it
Mhm,
definitely helps me see people, especially, people. I talked to a friend of mine in Tennessee, talked to you in Florida. So
mhm.
I think that part for me, I appreciate it. So yeah.
Yeah. I mean, I do have Zoom overload. I'm like, not another dang video call, but I do appreciate the in the moment connection. So, and as a therapist, that is the trend. Like people now want to do therapy telehealth, and I feel that it still translates. And I had some clients who are like, "Oh, no, I need to see you. I need to be in the space with you." But I feel that my personality really translates to the camera, don't you?
Yeah. Yes, I think it does. I think it does.
Yes, but it's another blessed morning, another great day, and I'm so excited about our topic today.
I have a word for the day, John 13:34 to 35, and this is the message version. Let me give you a new command. Love one another. In the same way I loved you, you love one another. This is how everyone will recognize that you are my disciples, when they see the love you have for each other. I know you have a quote of the day, Nadine. Let's hear it.
Hey Joy, I like that quote. It's a powerful one and a familiar one. Here's my quote of the day. It's not our differences that divide us. It's our inability to recognize, accept, and celebrate those differences. Audrey Lorde.
I'm excited too. So part two of our discussion on racism as a public health crisis. So yeah, so I'm excited about it. And one thing in the little bit of research that I read that I didn't realize, I realized that New York City had declared racism a public health
Mhm.
crisis, but I didn't realize that so many other places had done that as well. So it
Yeah.
wasn't like New York, which I think of the leader in so many things, was leading to the party, but they were one of like 200 other municipalities across the
hmm
country that have
hmm
said that. So
I think people have always known that there was there was some disconnect, right? And as far as why one group of people are able to accomplish and achieve and experience and another group has not been. And I think by giving it that title and putting the verbiage to it, it makes it real, right? I'm hearing a lot of people up in arms about the discussion. And I'm like, just because we didn't talk about it doesn't mean it wasn't existing. So, and that's with therapy, right? Sometimes with people coming to therapy gives the word, it forms it. So doesn't mean that your problem wasn't there because you weren't in therapy, but now you understand what the scope of it is, could be, will be.
Yeah, that's interesting. That trend to actually working on it changes the
Hmm.
perspective of it altogether. Naming
Hmm.
it changes it.
And
Yeah.
that's all we did. That's all that is happening at this moment is that it was named. And I think once people recognize that, it doesn't change the reality of the situation. You just named it.
Hmm. Yeah. And reading one article, the person was saying that that was disagreeing that racism was a public health crisis. And a lot of
Hmm.
what he was saying was that we still need to do all these other things.
Hmm.
Um,
Absolutely.
and I think that we still need to do those things. I think we're in agreement on that. We still need to do those things. We still need to look at what has happened, the redlining that's happened, the all those other things that have happened, and saying, okay, we need to pay special attention to make sure that we change those things. Um,
But we haven't spoken about it in all these years, in all these centuries, right? So, and nothing has happened. So again, to individuals who are like, who believe that this is now going to bring to light some misdeeds that have happened, I'm like, it doesn't bring to light anything, right? This wasn't like it was a body buried in the backyard and oh, all of a sudden it became real. It has always been there. And now let's do something about it instead of wasting energy on saying we can't talk about it. Let's not talk about it. Well, it's not that bad.
mhm.
Right.
Yeah, and it helps people to look at other things. I know one of my favorite community-based organizations in New York is the We Act for Environmental Justice. So it
Mm-hmm.
helps people to talk about what's happening in Harlem. So
Mm-hmm.
in Upper Manhattan, right? Because it's not just Harlem. So all the roadways that go through Harlem. So
Mm-hmm.
why are our young Black children experiencing asthma more? Because they have
Mm-hmm.
more pollution, because we have all the major roadways that go through. We have the bus depots that are there, that the majority of the bus depots in Manhattan are in Harlem.
Mm-hmm.
The sewage treatment plant, which we beautified by putting a park on top of it, is in
Beautiful
Harlem,
space.
right? Right. Yeah, beautiful space. So I think it makes a better conversation and will help people engage in talking about it and fighting for it. So we have the WEACs that are talking about it, but other people
Mm-hmm.
now like, okay, this is what's
Mm-hmm.
happening. So we need
Mm-hmm.
to be concerned about that.
Mm-hmm. Absolutely. And those are those environmental factors that I think at times get overlooked. And let me be clear that poverty does not only affect Black and Brown communities, right? Poverty affects all communities. So for people who it's just something that we need to be very conscious of. And but we have a high percentage of people, Black and Brown people, living in these communities, so therefore the impact is greater, right? And though you may not have access to fresh fruits and vegetables, I'm aware of many communities where Black and Brown people live in order for you to get fresh produce, right? You have to go to a whole nother community where there's a Whole Foods. And Whole Foods is not in all communities, right?
Mm-hmm.
So it's like my goodness, like just for me to get fresh fruits, quality fresh fruits and vegetables, I have to go somewhere out. If I go into certain supermarkets in certain places, I don't want to eat the fresh fruits and vegetables because they're wilted, they don't look appetizing. I go to a place like Whole Foods and I'm like, I'm a vegan. I am going to be eating naturally. Like it inspires you to make those healthier choices. But it's the environmental factors are significant and we cannot overlook those impacts.
Yeah, and when you speak of Whole Foods, or some people call whole paycheck, because I think because
That
right,
too.
right. So that was the advantage of the merger with Amazon. They were to make some of the prices more reasonable, but there might be some food in the neighborhood that is as cost prohibitive than if you go someplace else, or fewer farmers markets, and those types of things. And then I think we have to really be concerned about the entire food chain. So I was at a conference this week for Healthy Churches 2030, um, and there was some Black farmers. So the church had set up a process where they would go to the Black farmers and get produce from the Black farmers. So there are things that people can do that require organization, energy, and effort when they don't have the resources that they need, that they should have. But it requires us talking about it, and talking about how this is problematic. And it is an issue of that happens to poor people, but the racism and how that is a problem for all of us that aren't poor. When we look at the issues of what happens to uh, maternal and infant health, those pregnancy-related deaths and pregnancy-related deaths for the mother or for the child happen at more than 3 times the rate for Black women than for white women, irrespective of your education level. So even if you have a PhD, if you're a Black woman with a PhD, you are more likely to die in childbirth than a white girl who only hasn't even graduated the 8th grade, hasn't completed the 8th grade, right? So that's one of the reasons to look at it as the racism and to really focus on that. Because sometimes I think the issue that we have is we're creating solutions based on low income and low education when it covers a spectrum of us. So we have to say, okay, how is racism playing a part here? How is that happening, so that we can make sure that we are creating a solution that makes sense? Because some of the solutions that people are creating for people with less income don't work for other people, because they don't have access to those things that people on Medicaid can get, or people that have special programs, or that people don't think that they have, that they like, this doesn't qualify. I'm not that person, so it's not for me. So
Yeah. And the effects of racism on health, right? I think I read somewhere, I know I read somewhere, where even though a person of color in 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 the upper income levels still have you know greater, I guess, more health issues than a white person comparable of the same income. And when I saw those stats, I was just like, that's kind of interesting. Like, why is that? And I really started to think about the culture and the foods that we eat, and what we were brought up on, and just the whole history behind the types of things that we eat. The Caribbean, we eat the oxtail. Well, it's very tasty, but why the oxtail, right? Which is a fatty. It can be pretty fatty. And when you go back into the historical context of how that came to be, and that the meats that people of color or poor people were forced to eat were not necessarily the more leaner cuts of meat. Didn't really have access to the, the the range of fruits and vegetables, right? So you're raised up with these dietary choices that you just don't incorporate as you get older. Um, Exercise, physical activity. And I think I shared this with you, Joy. When I was living in New Jersey, I would get up Saturday mornings, and there was a park nearby. And at 7, 8 o'clock in the morning, there were families in the park, okay? White families, Asian families, they were in the park, doing different things, just walking around, exercising as a family. There were no Black and brown families there. And it wasn't, I lived in a community that was diverse, but it wasn't part of the experience that, families weren't getting up and dragging their kids, not dragging their kids to the park, but bringing their kids to the park at 9 o'clock in the morning just to get some exercise and activity, right? We figure, hey, we work hard, I'm not getting out. This is my time to relax and take it easy. We don't see exercise, and let me not be general. Some people don't see exercise as part of, a fun lifestyle kind of habit.
yeah, I think that's very true. I think we go to members of my church and I will go to Eisenhower Park, so a large park on Nassau County, and the number of Black people is significantly less than than other people. So I think there's some times where families will get their kids, or their kids are in football or they're in a sport, they'll get up and they'll do that. But thinking about making sure that they get that activity as well, and making sure out of season that people are doing that. I think that it has to be more of a priority that we do it, and it has to become something that we think as not just healthy, it has to be fun. So that's why how some of some things I started for SoulJoy Wellness are like faith, fitness, and fun. It has to be fun, as opposed to people being just feeling like, okay, this is just drudgery. So it's going to the park fun. And for kids, sometimes they will complain about stuff before they do it, and then they get there and they'll have a great time. I know I do some activities with some teens, and they're really like, oh, this is boring. But once they start doing it, they're like, oh, this is really great fun. I'm having a good time. And they're burning calories being active. So I think that's the key of saying, how can we integrate that in? How can we make it happen?
And my experience with kids and going to the park, you tell them, no, you're going to the park, and they're like that. They're excited about it. And they're like, yeah, let's do it. Recently, I was in Maryland. My sister-in-law just had their second child. And so Auntie was taking care of big sis, who was like 3 years old. And I would get up in the morning, we'd get dressed, and I'd be like, we're going to the park. And she was like, yay, going to the park. And we would go to the park. But, I'm on a time schedule, and she's having the best time of her life. And then I'm like, I'm going to have to be that person. And I would have to scoop her up because she never wanted to leave the park. And for the 5 minutes that we're walking away, she's like, playground, right? But, my thing that kids, and so I digress slightly, but kids love being outdoors. You send a child outdoor if you start them up, if you raise them up in that, it's almost like, yeah, that's what we do. This is the fun thing. This is what life is supposed to be like. I know me personally, my parents were not taking me to any playground. I don't ever remember me and my parents in a playground. Now, if it was a family picnic, barbecue, where there was going to be some food, some curry goat, and all that stuff, absolutely, we would all be there. But they were not going to the parks. That was not how I was raised. So I've had to incorporate that as an adult, right? Being very intentional about being outdoors more. I have neighbors who had a challenge. They had a family challenge. They had to, I don't even know how many hours, but there was a certain amount of hours they had to spend outside with their kids. And I was just like, I was like, that was never going to happen when I was growing up, because I grew up in a community where you may not want to be outside too long, because the kind of people who were out there weren't necessarily people you wanted to be becoming too friendly with. So it's interesting how the different environments can foster different lifestyles.
Yeah, and that gets back to some of the issues around racism, is that we are relegated because of redlining. We can only buy in certain places, only buy and live. So there's less home ownership, and we can only be in certain places where those places had fewer resources, right? So it wasn't just like all these places are similar. There's like a fewer resources, fewer protections.
Safety.
Yeah, and safety is a big one. And then when we talk about the racism of it, is the impact of actually believing that there's racism does to your body and to your mind and to your overall health. So yeah, those are some interesting things. But one thing you did mention, because you come from a tradition that makes oxtails. I come from a tradition that makes chitlins, right? So those are like, what you took what you had to do what you could. So
they were tasty.
Yeah,
and knocked it out the park.
Yeah, right. And people know how to make really flavorful food. Some other people that have the full range of whatever they have some really bland food, right? So for us, yeah. And I think one of the challenges that sometimes we have is when people want people to change the way they eat, they give them diets that don't really seem so flavorful for them. So that makes it a challenge. So we have to make sure that we make food that tastes good. My computer, it's just like, where'd you go? Yeah, my computer's on a stand, and clearly it's like it wasn't happy.
Yeah, I know. And I've learned I've been exposed to ways to make food flavorful. I feel that healthy eating has really grown in leaps and bounds in the last 20 years. I have a girlfriend who is going strictly plant-based. And prior to meeting her and tasting her delicious food, I used to have a saying about what's that ingredient? Geez, I can't even remember the name of it now, but uh, that it affects, like if you have celiacs and all of those, what's that thing?
Gluten?
Gluten. That's it. Sorry, I went blank. I used to have a saying, I've never met a gluten-free food that I liked. Oh my God. Now it's like, she's like, oh, it's gluten-free and it's plant-based and it's amazing. And it's not, it's just the technology that has gone into making these foods more flavorful. It's amazing. Now, I've also learned that sometimes those modifications in foods may not necessarily be the best either. Might be better for you just to eat the burger than to eat this modified, plant-based burger. But I'm just, for me, it's an option that I can now, I feel, incorporate more into my lifestyle to reduce certain things. But
Yeah.
I think I can be plant-based now. Beyond
Yeah, I think
salad.
there's some really good plant-based substitutes that aren't soy, right?
Hmm.
That aren't soy that are flavorful. There's
Hmm.
some things that are made from chickpeas. There's some things made from a lot of things. Even if you go into the pasta aisle,
Hmm.
particularly at Whole Foods because they have a lot of options.
Hmm.
But there are things that made with other out of other things, and some of them aren't. Some of them are modified, but some of them aren't. Well, Whole Foods, I don't know if they take modified foods, but yeah, we've managed to make a difference. So it makes it
Hmm.
also easier for people to find something when you're going to restaurants.
Hmm.
If you're trying to be healthy, like you can get
Hmm.
something, you can get a really tasty salad,
Hmm.
or there's some other options. So
Hmm.
I think of an Impossible Burger, which is
Hmm.
plant-based,
Hmm.
something that tastes like meat
Hmm.
to people. I
Hmm.
haven't eaten a burger in a gazillion years.
Hmm.
So I don't necessarily try to get that taste and texture. But for some people, I've had one. I thought it was good, but I like a veggie burger, right? I like a veggie burger. But and since I still eat uh, fish and chicken, so a salmon burger, and so I can do the variety. And it's
Hmm.
interesting because people getting more people to be plant-based and vegan. Um, Jermaine Dupree just came out with some ice cream, some vegan ice cream.
Hmm.
That yeah, I just posted about it yesterday. He must have come out with it in the last couple of weeks. Um, so there are other options and things for us to try. And one of the things for us to be healthier in that way is for people to make it like fun and aspirational. So because it's Jermaine Dupree, some people will try it. You can
Hmm.
order it online. I'm not being paid to do commercial. I order it from Walmart. Um, but yeah, so I will try his vegan ice cream. But right now, the only flavor I saw was strawberry, and strawberry is not my favorite ice cream flavor. So I'll wait for something else. But yeah,
Love strawberry. I'm definitely gonna look for that one. And
yeah.
I'm not being paid by Jermaine Free either.
I didn't really
um,
know he was vegan, but I've learned something new. So
yeah, there's a lot
mhm.
of people who have moved to it just because it's it that there are healthier outcomes by making those different food choices. And as we kind of and talk about how racism affects us, right? So we know the foods we eat will affect our health, right? But when we're unhealthy, we avoid the healthcare practitioner. We avoid going to the doctor. I am guilty of saying that I will not go to medical facilities in certain neighborhoods because I feel that it is subpar. So what if you're a person who lives in that community and you don't have a choice? Guess what you're going to do? You're just not going to go.
Mm, very true. Yeah. And if you know that you have subpar standards,
Mm-hmm.
or sometimes people don't recognize they have subpar and they accept the poor care, and they accept without questioning the physician, or without questioning, because especially if you were in a place and you need to get to the hospital, for the most part, depending on what you have, you're gonna have to go to the closest one, right?
Mm-hmm. And I've learned that because, people of color, for whatever their own personal reasons are for avoiding health, proper health care, that routine checkup, that getting your annual, they use emergency rooms as their primary care. So what happens? You go to the ER, and just for these, it could be something minor, or it could be something serious, but those serious things, by the time you get to the emergency room, it's too late for any kind of successful intervention. So how do we make our healthcare options more accessible to people of color who may not have the finances or economics to be able, feel more comfortable to participate in the healthcare forum?
Mhm. Yeah, those are really good questions. I think that's why people are advocating for healthcare for all, so
Mm-hmm.
that everyone has some health insurance or health access, right? And
Mm-hmm.
then to make it quality. And then some of the things like you were talking about, more therapy is um, done virtually.
Mm-hmm.
So telemedicine, and then the wearables, right? So I have on a Fitbit now that can tell you what my heart rate is, and it can sort of track, uh, other things. It can track my blood oxygen. It can track some of those things. So if we can do more of that to help people, so they don't necessarily have to go into the doctor's office, because we also have a lack of primary care physicians, and because of the economics of medicine has changed, it makes it less rewarding for people to do it, to go into those tracks. So how can we improve the efficiency and improve the exposure so that there are more primary care physicians in communities of color that are culturally competent? So yeah, it's a lot. It's one of the things to say that that is a systemic change, right? That's going to take a while
Mm-hmm.
to adjust. But in
Mm-hmm.
the meantime, what do we do for the people who are still here, still living, and need to
Mm-hmm.
get access to better health care? So I know I live on Long Island. I'll drive. I have a heart condition, so I'll drive from the South Shore to the North Shore to go to the hospital where, it's number one rated in arrhythmia. And there are a few other hospitals that are good as well. But I'll drive there, and even in that hospital system. So if you were in the hospital that's affiliated with that hospital on the South Shore and you had a serious thing, they would transport you to the other hospital, right? Because I know someone had a heart attack, and it was like he went to the local hospital, and they're like, "Yeah, we're gonna send you there because you need the best care. We want to make sure you have the best care."
We want you
So
to
how can
live.
yeah, we want people who really know. And think that I'm going to a arrhythmia center. So these physicians, these cardiac care physicians, focus on the rhythm. There are other people who focus on heart attacks. There are other
Mm-hmm.
people who focus on all these other different things. So yeah. So how can you make sure that you have that greatest access to that? So yeah.
Mm-hmm.
And
Mm-hmm.
because of redlining, we're stuck in neighborhoods that don't have that access. So it's a big circle. And I am an advocate for healthcare and housing, and those two things are really, really connected together. So
And I'm also an advocate for education. And when you think about those health disparities as it relates to education, you can tell without even knowing about the economics of the community, the difference between walking into a school that has access to funds, right, to a strong taxpayer base, and a school that's struggling financially. I know as an adult, I walk into the schools where I know they have resources and I feel excited. I want to learn. It's exciting. And I have opportunities to learn different things. And I walk into another school and I'm just like, oh my God, you feel the chaos. And although the teachers there, and kudos to those teachers who are really working with very little, who have to dig deep into their own pockets to create a, a, a learning environment where children can thrive, because it is not easy. I have many friends who are educators who are serving minority communities, and they're not getting those that you go in the classroom and it's well done, and that's out of their own personal pockets. So,
Yeah, and I think that the premise, though, that it has to be that way, because it doesn't have to be that way. So if we decided that education was a priority, and irrespective of the amount of money, the tax base of that community, we were going to reallocate, because that's what we do with our taxes when we pay them nationally. We're going to reallocate and make sure that everybody had some higher level of standard, that there was a per pupil spending in a community that it couldn't go below. I mean, that would change things immediately, right? Overnight, it would change things. But that's not that priority. And the notion is that, we're just taking care of our own in our own community, when there's that larger impact to the community of people who may not have sufficient education and may feel that they don't have the opportunity. So it's a circular thing, that it creates a poor environment. Yeah. So now that all of these places, these 200 places across the country, we're really going to have to revisit this as an issue, as a topic, because what changes will it make? Because we can draft some resolutions and say some things, but the next things are what really are the actions that people are taking. What will be happening in the communities that have said this? And some of these communities are not predominantly people of color. Some of those communities are predominantly white communities that have recognized that this is an issue. So what are they going to do, and how are they going to feel the impact, and how are we going to feel a change in this society that really right now is really at this inflection point where there's a lot of hostility and a lot of that I don't know the other word to say, but that is that race is a challenge. The benefit of us talking about it is great. Now, can we get some real action? Can we get some real movement?
And I think as a final note, I do believe that there are more people who recognize that there is an issue and that something needs to be done, and that are completely on board to doing things differently. But sadly, it's the minority that, the loud minority, that really distracts from the work that needs to be done. And I say, if you can acknowledge or recognize that you're a distractor, right? Let's stop talking about why it isn't, and let's just do something about it, right? It's like when my kids, when I come in the house and there's something on the floor, and everybody agrees that something fell on the floor, and I'm like, can somebody pick it up? I want to hear, well, I didn't do it, and that, you get all these excuses. Okay, is there not a problem? Let's work on the solution, and not trying to point fingers on why it's not you. Okay, we live here together. So that's my mommy plug.
I love that. Yeah, we live here together. How are we gonna
fix it?
Yeah, I love that. That's a good way to end. How are we together gonna fix
How
it?
are we gonna fix it? Yeah.
So this has been fun.
As always.
So make sure you join us next time, and there'll be some links in the notes. So for some references to all of these places that have declared racism a public health crisis. So
kudos. Yay.
Yay. Thanks, Nadine.
Thanks, Joy. Bye.
Bye.
Join us next time as we continue to focus on living our best life on purpose.
Thank you for joining us on this episode of Road to SoulJoy Wellness. We hope you enjoyed the show. Please leave us a review on Apple Podcasts. We love your feedback and a chance to answer your questions, and we may even share your ideas on the show. Until the next time, enjoy your time on the road to SoulJoy Wellness.